Well, people used to ask me that question before the pandemic, and I always said a pandemic. And that's still true. As we have seen, pandemics have the potential to be incredibly deadly and disruptive. And yet, despite everything we have been through, the world remains unprepared for another epidemic or pandemic. So it's vital that we learn the lessons COVID-19 is teaching us and make the changes that need to be made to the global health security architecture. The danger is that we become distracted by other crises, and there are plenty of them, and fail to make the world safer against future epidemics and pandemics. But you're right. There are many other health challenges that demand our attention. As we speak, we're fighting Ebola in Uganda, cholera outbreaks in 28 countries around the world, numerous outbreaks in Pakistan as the floodwaters recede, famine in the Horn of Africa, and of course, the global monkeypox outbreak. On top of that, progress against HIV, TB, and malaria has stalled or gone backwards, and non-communicable diseases like heart disease, cancer, and diabetes are increasing around the world. And then, as you said, the climate crisis is making the planet on which we depend less habitable. The single best thing that every country do to protect against all of these threats is to invest in strong primary health care at the community level. Strong primary health care is the best way to promote health and prevent disease, and it also operates as the eyes and ears of the health system, helping to detect outbreaks at the earliest opportunity. In at least 3 ways. The first relates to what I just said, that over the years, many countries, particularly high-income countries, have neglected primary health care and invested heavily in advanced medical care. Don't get me wrong, that's important too, but some of those countries that neglected to invest in public health and primary health care were overwhelmed when COVID-19 hit. So it's a matter of balancing, investing in all levels. By contrast, some countries with fewer resources did better because of the muscle memory they developed from previous outbreaks of SARS, influenza, Ebola, and so on. And so they invested in primary health care and public health because of their experience in past SARS outbreak or epidemic. Secondly, at the global level, one of the main problems has been a lack of cooperation, coordination, and solidarity. It has been largely every country for itself, me first. That's why countries have now agreed to negotiate a new international accord on pandemic preparedness and response. There are international treaties against nuclear weapons, tobacco, and climate change. So it makes sense that countries agree on a common approach to a common threat like pandemics. I stress that this accord is being negotiated by the nations of the world, and each nation will adapt it and implement it in accordance with its own laws and circumstances. The third thing is that the pandemic has shown that the production of vaccines and other essential tools is too concentrated in a few companies, in a few countries. When the first vaccines were approved, poorer countries just couldn't compete with the wealthier ones, who bought up all the vaccines and left the other countries behind. And they're still behind. So it's clear we need to diversify production globally. Last year, we set up the WHO mRNA Technology Transfer Hub in South Africa with a company called Afrigen that has developed its own mRNA vaccine and is sharing the technology with 15 other countries around the world. So we think this will be very important for ensuring more equitable access to vaccines in future, not just for COVID-19, but for other diseases as well. I think the key thing is that we have to listen to the concerns and questions that people have. Historically, in the scientific and medical communities, we have sometimes had the approach that we're scientists, we're the doctors, we have all the answers, so just do what you're told and don't ask questions. That was never the right approach, but it certainly is not the right approach now, where people have access to far more information, good and bad. People will only follow advice if they trust the person or the institution giving that advice. For example, during the West African Ebola epidemic in 2014, one of the biggest challenges we faced was how to handle dead bodies. Many of the affected communities have burial customs that involve mourners hugging and kissing the body of a deceased person, which of course is extremely dangerous if that person has just died from Ebola. Health workers who knew this tried to prevent families of a deceased person from touching the body. But that just created anger, fear, and mistrust. Some families would keep a sick person at home rather than take them to a treatment center. Out of fear, they would not be allowed to see their relative again. And that just led to more infections and more deaths. It was only by working with those communities to understand their customs and concerns that we were able to build trust and find a way of conducting burials that were both safe and dignified and accepted by the community. Of course, every community is different, but the approach must be the same. Listen to what people are saying, understand their concerns, and find a way to communicate scientific information in a way that people understand and accept. Obviously, we owe a huge debt to health workers around the world who have put themselves in harm's way to serve others. Applause is nice, but it's not enough. We need governments to invest in their health workforce and give them the education and training, the equipment, the working conditions, the pay, and the respect they deserve. We have done things that have never been done before, like the ACT Accelerator and COVAX, which have helped many countries get access to vaccines and other tools. They're not perfect, and we can learn from our experience for the future, but certainly we have made access to these tools much more equitable than it would have been otherwise, especially relatively to our experience in past pandemics. We can say that there is good progress this time. I'm also encouraged that the international community appears to be acting on the lessons we have learned a new global accord is being negotiated. We have a new fund at the World Bank to support countries that need it. We have set up the mRNA Technology Transfer Hub, as I mentioned, and there are several other initiatives to make the world safer. I also have to say I'm incredibly proud of my colleagues at WHO. From the moment we got the first alert on New Year's Eve 2019, they didn't have a party. They didn't say it can wait until tomorrow. They were on it straight away, and they have been working night and day ever since to support countries to protect their people. The pandemic has taken a toll on them like it has on everyone else, and they have taken a lot of unfair criticism. But they have incredibly professional, dedicated, and passionate about doing everything they can to save lives. I couldn't ask for anything more.